I am here with Dr. Brad Stevenson from Ogden Clinic. Thanks for being here.
Thanks for having me.
All right, today we're talking about something that a lot of us may not be aware of, and that is bladder Botox. Explain what that is.
So when you think of Botox, you probably don't think of your bladder, you think of wrinkles. But for the bladder, the Botox works kind of the same way as wrinkles, except in this case we're using it for an overactive bladder, a bladder that squeezes too much.
Okay, and let's talk about an overactive bladder and the symptoms and severity, because I'm sure there's a range, right?
There is. So overactive bladder is a condition where your bladder's telling you you've got to go to the bathroom too often. So you can't make it through a meal, road trips are out of the question, you know, you're getting up all night long.
It really interferes with your life.
It does. And that's the point where you seek treatment for, is when it's really messing up your lifestyle, basically.
Okay, and so we see there's moderate, which you just mentioned. Maybe you have to get up day and night.
Right.
And then after that, severe.
Sure.
Which then, I would say, you say is when you just have to run.
Right.
Maybe you don't just have the urge, you have to run.
You get the urge, and if you don't make it to the bathroom, you know you're not going to make it. So you run, there's no waiting.
And then the extreme is when sometimes you don't make it in time.
Yeah, so you're wearing pads, you're getting wet, and that really impacts your life. Some people don't even go out of the house because of it.
Yeah, okay, so we want to talk about who this affects.
Okay. It affects mostly people in their 50s and 60s. A lot of it's women. Men can get overactive bladder. Usually it's more of a prostate issue in men. In women, the issue is sometimes just the overactive bladder.
Okay, and then what is the procedure like? It might scare some people thinking of Botox.
Right.
What can they expect when they come in?
Botox is not the first-line treatment for overactive bladder. These are people who have tried changing their fluid intake, they've tried the medications, and either the medications don't work or they can't tolerate the side effects. And so this is a little more invasive. We try the less invasive things first, but for the people who it becomes very severe and is impacting their lifestyle, they do this procedure. And it can be done in the office, depending on your comfort level. Some people don't like the idea of being awake for it, so you can do an outpatient procedure under sedation.
That's good to know.
Yeah, but basically it's a scope that you place into the bladder. There are no incisions, and then you do small injections along the bladder wall.
Okay, and then what are the effects? After someone receives this procedure, what happens?
It works very much like the wrinkles. When you inject the Botox into your face, what it does is paralyze the muscles so that you can't squeeze the skin to make the wrinkles. The bladder is actually a muscle itself, and when you use the bathroom, it squeezes. People with overactive bladder, the bladder squeezes too often or too soon. So injecting the Botox into the bladder does the same thing in the face. It relaxes those muscles so that you can hold more urine, and you have a longer time in between your trips to the bathroom.
Okay, fascinating. Who knew?
Yeah.
Thank you, Dr. Stevenson. So good to know. And if people have questions, they can obviously go to your website. We've had your number on the screen as well.
Great.
So,
Well,
thanks so
for having
much. We will be back with more after this.